and we're going to then see what we can do to post these recordings on our website or somehow make these recordings public so that people who can't participate will have access to the information that was shared today. We will be doing these calls at this same time every week for the foreseeable future, and so people will get an invitation so that you can join us again next week. Because this is our first call, we got a whole bunch of questions, so what I'd like to do is just jump right into those questions now. Just so that you're aware, in the room with me, sitting some distance apart so that we maintain appropriate social distance here, are Kirk Dobson, our Deputy for Quality Assurance, Crystal Thomas, our Program Manager for the State Office of Policy Planning and Innovation, Winslow Woodland, the Deputy for DDA, and we have a number of DDS staff online as well. And as I said, we have a total of 108 people online, so why don't we go ahead and get started. Crystal's going to read through all the questions, and I will answer them to the extent I can, and I'll call on my staff to help in circumstances where we need that. To the extent we're able to get through all these questions, we may be able to take additional questions. So if people have them, they could be typing them in on the chat bar over there down at the bottom. You can see a little chat bubble. Type in there, and we will get to those questions at the end.
Good morning, everyone. This is Crystal. First question is, how will this affect people on the waiting list?
So DDS has no waiting list, and so therefore, and we don't anticipate having a waiting list. So none of what's happening now has any effect on any waiting list, because fortunately in the district we've never had one.
Son cannot talk. Speech therapist did not come last week. They come out anyway. Will services continue in person or virtual or suspend? Family doesn't have app that therapists suggest using this time.
Okay, so any questions that anyone has regarding their services, you should call your service coordinator. All of our service coordinators are working full-time. They're all teleworking, but they are all available full-time. So when you have this kind of question, please reach out to your service coordinator. There should be a discussion with any allied health professional that's providing services about their ability to provide those services remotely. A lot's been done in the district and across the country to relax rules that will allow people, to the extent they can, to provide those services remotely. There should be a discussion with the team about if they can't be done that way, about whether it's better to delay the service, or a discussion also with the service provider about how those things can be handled.
What if you disagree with your DSP or employer about staying inside and not going out into the community or working?
So as I read through all the questions that we got, what occurred to me is that I want to repeat several times in this conversation today the guidance that all of us have gotten from public health people, from the CDC, from DC Health, guidance that they've given us about how we can stay healthy, which includes limiting the number of people that we have contact with, making sure that if you cough or sneeze that you do it into a tissue and throw that tissue away. If you don't have a tissue, that you do it into your sleeve. Keeping a distance between you and other people. So that means about 6 feet, which means if you hold out your arms and the other person holds out your arms, your fingers don't touch. That's how far we need to be from each other, because this is a virus that passes from one person to another, but it can only go so far. So it's important to keep that distance. And so the reason that DC and Maryland, in fact, have ordered a number of businesses to close and have asked people to stay home to the extent that they can is so that we can limit the number of people that we have contact with. So, is it okay to go outside? That's a conversation that you and your DSP and your house and your team ought to have. How do you spend your time while you are sort of stuck at home? One of the things that the mayor has said when she's given people advice is, if your family wants to go out for a walk, that's great. If the people you live with together want to go out, what's important is that you not be going to places where you're getting together with other people. So the ideal is for you to have contact with as few people as possible. And lastly, that we all pay attention to our health, pay attention to how we're feeling. If you have a cough, shortness of breath, or notice that you might have a fever, it's important to let someone know that and talk to a doctor about what you should do.
What if my DSP is sick and not available to take me to the doctor?
So all providers should make sure that staff are in place. If the DSP isn't available, another person would be available. Also, it's really important to emphasize, we keep talking to people about this, if you have a doctor's appointment or if you are sick and feel you need to go to the doctor, you should be calling their office in advance about whether this is the right time to go in.
What are ways to check in with my job site about the operating status if I don't use the computer or email?
Two ways. One is by phone, and secondly, if you have a job coach or any staff that helps you with work, to ask them if they can check in.
Can DDS help me with Medicaid benefit questions during this time?
So one thing that you should be aware of is that between March 1st and May 31st, the expiration, any Medicaid that expired between those 3 months, the expiration date has been extended. But DDS can assist with those questions. So you should call your service coordinator with any of your questions about your Medicaid.
Any phone numbers we should know just in case our service coordinator is unavailable?
So what should be happening is that the service coordinator's supervisor's telephone number is on their voicemail. So if you call your service coordinator and they're unavailable, then you can call their supervisor, whose number should be on that voicemail. You can also always call customer service at 442-8686 during business hours. You can also call Winslow Woodland, the deputy, at 202-730-1618 during business hours. We have a phone number on our website after business hours that people can call. The easiest number to remember after business hours, if you need to get in touch with someone, is 311, and tell them you have a question regarding Department on Disability Services, and they will put you in touch with our person on call.
The date for taxes to be filed was pushed back to July. Can I ask my service provider to help me pay them still in time for April?
Absolutely, and especially because those people who are getting a refund, for people who owe money, it's very helpful to wait until July. For people who are getting a refund, you would want to file as soon as possible. Also, with the funds that are about to come from there were funds that were approved by the Senate. We hope they'll be approved by the House. People who have been paying taxes may be getting a check from the government, and the fastest way to get that check is direct deposit. So people who are filing taxes who can put their bank account number when they file their taxes will get that check from the government most quickly.
Do I still have to pay my rent on time?
Yes, is the simple answer. Let me just say, there are restrictions right now on evictions. However, rent is still due every month. So just the fact that you couldn't be evicted right now, to the extent you're able to pay your rent and not get further and further behind, once this ends, all that rent will be due, and the limitation on evictions will end as well. So to the extent you're unable to pay, you really need to be talking with your service coordinator about that difficulty that you're having so that you all can brainstorm about how to address it, rather than relying on the fact that people can't be evicted for this short period of time.
My ID expired during this time. Is it okay?
So in D.C., the DMV has extended the expiration date for all documents that expire between March 1 through April 28th. And those are good until May 15th. So if it expired right now, you should be good up until May.
What compliance protocol, policies, directives, or guidance has DDS provided to their providers for the protection of facility staff like group home direct support staff, community programs, et cetera, to ensure that not only facility residents are protected, but staff families are too, because these staff members return home daily from work to interact with families, some of who have elderly and children?
So there are two websites that people ought to be checking. One is coronavirusdc.dc.gov, which is all of the latest guidance from DC Health and from the district government regarding coronavirus and the district's response to it. And secondly, at dds.dc.gov, right up at the top, it says COVID-19. I'm just looking it up right now so I can tell you exactly. There's a long, thin box right at the top of our website that gives you COVID-19 updates. You can click there and you will get a link to all of the guidance that's been issued by the Department on Disability Services. And I would really encourage people to check back regularly. As people know, the facts on the ground have been changing rapidly, and so it's important to keep checking back to see the most current information.
Director, this is Kirk. Just letting everyone know that I'm typing a link into the chat box as well for everyone's use.
What oversight and accountability measures has DDS and sister agencies put in place to ensure and enforce compliance by facilities and staff, considering that low-level and less educated staff are usually where there is the risk for greater negligence, but also exploitation by providers who prefer to save money at the expense of staff and residents' needs?
So I just want to say, first of all, I was told be careful if there's a video, watch the look on your face, because there was quite a look on my face in response to that question. First of all, I want to take a moment to really appreciate the hard work that I've seen our providers and their staff doing. As I said, this thing is changing day to day, and they are all working really hard to keep up with it, to continue to support the folks that we're all working together to try and support. And so, you know, we really appreciate their dedication and hard work during this really difficult time. We do have comprehensive training protocols in place that assist DSPs to carry out their job responsibilities. We also have a weekly phone call with providers. We provide them the most up-to-date information. All of our staff, well, over 90% of our staff are teleworking. Those who are not teleworking are right here. All of our staff continue to work during this public health emergency, and they're reaching out regularly to the providers to check up on people, to check up on how the providers are doing with maintaining staffing, what resources they have. So I think that we're doing a pretty good job. Our staff, as well as our provider agency staff, doing a really excellent job of responding to this really unique crisis.
What is the status of DDS claims, examiners, and other staff who help make medical determinations on SSI and SSDI claims specifically?
So this is about Social Security claims for people who aren't aware. It's about people who, so DDD, which is the Disability Determination Division at DDS, will continue processing all claims. All DDD examiners and the medical staff that assist in making determinations are currently teleworking. What's really helpful is that Social Security has been wanting to move to teleworking, and so they've been using the DC office as a pilot to try and introduce teleworking. So we've really had a much easier time with this transition than many other parts of the country. So in fact, at this point, we're starting to get some claims from other states because we're ahead of, we're at over 100% in terms of where we need to be during the year in processing claims. So things continue to move on schedule.
Are claimants still being scheduled for consultative examinations? Are CEs that have been scheduled now canceled?
So the consultants are still currently being scheduled, and they're being performed by the provider, and they have some protocols in place to ensure that those are done safely. You know, to the extent they can, they would do this remotely, but they also do see people in the office. We've been careful to go into the office where people are seen to make sure that appropriate measures are put in place so that people can maintain social distance while they do this. What's really important is, we have a recognition that this is really an essential service for people, because the reality is some people are waiting on this determination in order to get a Social Security disability check. And so those at this time are still continuing. Depending on how things go, that may change. But at this time, all appointments that have been scheduled, they have maintained them.
What is the best way to submit evidence to the DDS? Is mail being picked up or held so that P2 isn't piling up outside the office? PII. Yes, we have staff who are coming in every day to bring in the mail. The mail is handled securely, so there's no concern about mailing things in. U.S. mail is the best way to submit things. It is also acceptable to submit things via fax. And if I don't have the fax number in front of me, but if you have received anything from Social Security requesting that you submit documents, or from the Disability Determination Division requesting that you submit documents, they include a fax number in their request. You can fax to that number and they will be received securely. Are continuing disability reviews occurring and DHO hearings being held? So at this time, all hearings are being postponed until SSA lifts the restriction and the workloads can continue. The continuing disability review continuances only are being completed, and all other continuing disability work is halted as per instruction from the Social Security Administration. Is the DDS prioritizing CAL, QDD, critical, and presumptive disability claims? Yes. So those, for people that don't know, are the emergency sort of people who have a critical illness where it's essential that the benefit be in place as quickly as possible. Those are prioritized, as they always are. How long is the quarantine going to be? So first of all, what we currently have is not a quarantine. Some people may be quarantined, may be asked to self-quarantine if they have been in contact with a person who has a diagnosis of COVID-19. Most people are being asked, all of us are being asked, to the extent we can, to stay at home. The current order goes through April the 24th. So at this time, everyone is being asked, and as I said earlier, what's most important right now is that COVID-19 is a virus. It passes from one person to another through either them coughing or sneezing, or sometimes when we talk, that little bit of spit that comes out that could transmit the virus from one person to another. And that's why it's very important that we remain at least 6 feet away from other people, because any of those little things like a cough or a sneeze aren't going to travel more than 6 feet. And so that's also why it's important that we limit the number of people that we interact with. So going out should be limited, although going out, being by yourself, walking around the block, being in the sun, that's healthy and good. Just make sure that you do it without going out and meeting up with other people, because we want to limit the number of people that we engage with. We want to go out and go to church and have our freedom. What if we want to attend and even online but need help? So if you want to attend online and need help, you should talk to your provider. Or if you're living at home, you should talk to your service coordinator and see if there's some way that you could get some help with that. For folks that have churches that do online, to even reach out to the church and see how they can help. I think it's particularly troubling that right now, church that many people rely on as a source of support, that they're also closed. And that goes back to what I was saying before, because we don't want people, we want to interact with as few people as possible. People may recall that the first cases that we heard of in Washington, D.C. were related to a pastor in a church who
had a service and was interacting with people, and we learned later he had COVID-19 and then gave it to other people because they had so many people together in one place. So right now, groups of 10 or more people should not be occurring, and even when it's fewer than that number of people, we should be keeping at least 6 feet between us. And as I said, that's about sort of you stand with your arms out and the other person has their arms out and your fingers don't touch. That's how far apart we always want to be from other people to keep ourselves healthy and to keep other people healthy.
Do you have any clue when coronavirus is going to stop? Are we near the end?
I wish that I knew. I'll just reiterate. You can keep checking on Corona, coronavirus.dc.gov for updates. There's daily updates on the status of coronavirus in DC. I also want to say, it just occurred to me, as I keep repeating what we all need to be doing, I didn't say washing your hands. Wash your hands, wash your hands, wash your hands. Because while other people cough on a surface, if you touch that surface and touch your face, that's how the virus can get in.
Is this a virus that is coming from the air or people?
It comes from people. The problem is people could cough on a surface that you would then touch. So for example, if you ride the metro and you touch the handrail on the metro and someone had just coughed into their hand and touched that handrail, there could be virus there. And that's why touching your hand, that's okay. Your hand then touching your mouth, your nose, or your eyes, that's how you end up getting the virus. Wash your hands. The best thing is with soap and water, washing your hands regularly. If you are out and don't have access to soap and water, hopefully you have some hand sanitizer.
If I have allergies and I sneeze, will I spread this to anyone else? Some people are panicking that allergies are some.
You know, the concern right now, it's bad. We're about to really enter allergy season. Some of us are very aware of that. And I know that all of us, when we hear a person around us cough or sneeze, we get a little nervous. You can only give someone coronavirus if you have coronavirus. But at the same time, that same rule applies whether you have it or not. When you cough or sneeze, if you have access to a tissue, you should do it into the tissue. If not, you should do it into your sleeve. If you cough or sneeze in a tissue, throw it away immediately. Make sure and wash your hands regularly.
How many nurses do we have in the field? Are services continuing? Are more nurses being brought in?
So the answer to that question is with regard to DDA providers, we are not bringing in more new nurses. We do have over, let me give you the exact number of nurses that we have in the field today is well over 200, and that is between day providers and residential providers. Okay, let me give you the exact number. So currently we have, 145 registered nurses and 187 LPNs for a total of 332. And as I said, that is residential and day providers. And those who were working in day programs that are not currently active should be eligible to work or are eligible to work in residential facilities.
Is there an increase in behavior concerns related to people feeling isolated? How can people still have some type of socialization?
So we haven't actually seen an increase in people having difficult behaviors, but I just know anecdotally, talking from people I know, from everyone I know who is staying in and doing as they've been told to do by the mayor, or when they live in other states by their governor, that they're kind of climbing the walls right now and figuring out how do we get through this and, how to reduce the anxiety. One, when people stay home, they're listening to the news sometimes all day and just getting more and more nervous about it. I think that these are really important conversations to have within each of your homes. Given the limit on we can't go out and see other people, what can we do together that doesn't involve us getting together with other people? What can we do in small groups of people where we can make sure that we maintain a distance from them? It's really important to come up with plans about how to spend your day, how to continue to do things, that we enjoy, so that to the extent you can, that life can go on.
Can you encourage the mayor to sign the DSP wage raise bill during this crisis?
So, we're going to defer to the mayor's office about decisions she makes on this. That wage bill would be something that would go not just during the crisis, but well beyond. The reality is we are in the middle of, we should have an update later today on exactly when it's being submitted. We are doing filing an Appendix K, which is a change to our waiver with the Centers for Medicare and Medicaid Services so that we can look during the public health crisis. There may be some changes that can be made regarding wages addressed in there. We're working that out with DHCF now.
When can I get back to work? I need to do something.
Fully understand that sentiment. And it really depends. It depends in part on the kind of work you do. For people who work, for example, at a grocery store, they could still be working, because grocery stores are considered essential services. There are a number of different kinds of work where people can continue to work. Unfortunately, it really depends on the kind of work that you have when your employer might be able to start bringing people back on. So it depends on, where we go in terms of people getting COVID-19, because depending on how many people have it and what the spread from one person to another looks like, that's going to determine sort of how long they need to keep measures in place where we're really working hard to limit our contacts with other people. So unfortunately, there's not really an answer to that yet. All I can say is refer back to the prior question, come up with the folks close to you about ways that you can spend your time currently to reduce stress and to really, sort of make the best of this time when you're stuck at home or at the very least stuck in your neighborhood. Because I do still have to come into the office, our office is open in case there are emergencies. On my way home, I see far more people taking walks, being in the park. As long as, I said, you're keeping social distance from people, you can still get out and get some fresh air.
So the next is a statement made by our fearless leader from Project Action. Ricardo wanted people to know and understand that they are not in trouble and that staying home is not because of their behavior.
And thank you for that statement, Ricardo, because it is a sacrifice that everyone is being asked to take, and it's a sacrifice that people are taking in order to protect themselves and the whole community.
If people cannot reach their provider, should they call 911?
No. If the house is on fire, yes. If there's a medical emergency, yes. Other than that, first of all, your provider should give you an alternate number. Like if you have a DSP who usually comes and you can't reach them, you should have another number from your provider that you can call. But as I said earlier, the easiest number to remember if you need to get in touch with someone regarding a service issue that's not an emergency where you're having a medical emergency or the house is on fire or some real emergency where you need the police, then what you want to do is call 311. That's the DC information line, and they will connect you with someone at DDS.
How often are service coordinators checking in with the people on their caseloads? They
are checking in as often as they would normally. They're teleworking, And every time I've had this conversation with our staff, I've said the accent in that word is on the last syllable. We continue to work.
How specifically are service coordinators ensuring that people have the staffing supports and supplies they need in their homes? Are service coordinators monitoring both people receiving residential services and the people living in natural homes? Is the monitoring oversight different in residential placements versus natural homes?
No, that service coordinators are continuing to provide services as they always have. They are doing so remotely, so they're not going out to visit people. The only folks we have who are visiting people would be in cases where there's an allegation of abuse that needs to, or neglect serious that needs to be investigated. Our investigators would be going out to check on the person. And there are circumstances where there may be health issues and our nurse practitioners would be going out. Other than that, people will be checking in by telephone, by FaceTime, by Skype, some other means of communicating with people. As I said earlier, the most important thing is to limit the number of people that you come in direct contact with.
Do residential providers have an adequate supply of protective gear and cleaning supplies? If not, what is being done to keep both DDA consumers and staff safe?
So a couple of things in response to that. One is we shared information with providers this week, some information that we got from DC Health, and part of the focus of that was really on how do we conserve personal protective equipment and gave guidance on when it is really needed. And so that guidance is also on our website and people can read that. It's very important that people understand it so that the people who actually need this equipment will have it when it's necessary. We have also given our providers information from DC Health, the administration within there, whose initials are HEPRA.
Health Emergency Preparedness and Response Administration.
Thank you. The Health Emergency Preparedness and Response Administration, so that they can connect with them about their PPE needs. Our quality resource specialists are also calling each of our providers weekly just to check in with them on their resource needs, how they're maintaining staff, how well they're maintaining the resources in the home.
What is the Department of Health guidance regarding what a provider should do if someone living in a supported living, residential habilitation, ICF home tests positive for COVID-19? DDS and DOH should distribute to providers and stakeholders specific guidance on this issue.
So that has been included in the guidance that we sent out, but it's also really important to know that when there's a positive test, DC Health steps in immediately and does help to make sure that that person and anyone else living in their home have the necessary intervention, whatever that may be. If we have had one person who has tested positive so far. DC Health intervened. They made sure that that person had a safe place to stay, checked in with the other people who'd been sharing a home before. This was someone who lived in her home with her family. And so, fortunately so far, we've just had that one example, but DC Health immediately steps in and they make sure they treat our folks the way they treat everyone else in the city, which is to make sure that when someone tests positive, they have the resources and supports that they need.
Does DOH direct providers to quarantine in place the person who tested positive or move them out?
It depends. And like I said, DC Health will step in and they'll make that determination about how to ensure the safety of the people in the home and ensure that the person who's tested positive is getting the supports they need.
What is DOH's guidance regarding the other residents of the home if one resident tests positive?
It depends. I mean, I could just keep repeating, but DC Health does immediately step in and they provide guidance depending on the makeup of the home. And they would answer those questions when the time came.
If the guidance is to move the person who tested positive or the other residents of the home, where should providers move them?
DC Health actually takes care of that. So the provider won't be told this person needs to move and that's the end of it. DC Health steps in and says, based on the configuration in this home, it's safer for this person to move elsewhere. And they have hotel rooms set up where people are having meals delivered and getting the care that they need while they need to remain isolated from other people.
How will DDS ensure the person who tested positive has staff support when it is likely most direct care staff will refuse to work in the home?
I don't know that I'd say it's likely, but
It's
I mean,
not
Winslow
likely.
can.
We have at least one case where a person is in the process of awaiting their testing, and the staff who graciously have been working with that person up until now continue to work with that person and have not left that person alone, and is supporting them through the process using universal precautions.
And as I said earlier, you know, our providers, their staff, DDS staff have really stepped up during this public health emergency. And so, you know, we expect that'll continue to happen.
What has DDS submitted under Appendix K to reflect flexibility in the provision of waiver services at this time? Has CMS responded to the DDS request?
So the Appendix K is submitted by DHCS. DDS helps to prepare it with DDS helps in the preparation of the Appendix K, and we provided a summary on our call last week of everything that had been included so far in the Appendix K. As soon as it has been submitted, we will post the Appendix K that's in draft form so that people can see. I will say that the Appendix K we're submitting is retroactive to March 11th, the date that the public health emergency was declared. And so as soon as we submit it, we can let people know that, you know, the measures, and we reviewed all these measures with the providers last week. I'll just quickly go over the areas that we're addressing, which is expanding the use of remote supports, expanding the settings where services can be provided, making some adjustments in terms of the level of care determinations where those could be, the determination could be continued if the team agrees. If an annual physical is due, pushing that off, making some changes in incident reporting so that our face-to-face follow-ups are not required in all cases. All cases are still reviewed immediately, and a determination is made about when a face-to-face is needed, and we have staff who do that. We're proposing some changes regarding our ISP development, ensuring that those continue to be developed on time but done remotely, where the consultation is with the team virtually. Making some changes in provider requirements, including some adjustments regarding delaying what are normally pre-service training requirements so that providers can bring staff on quickly as long as they ensure that they have qualified staff on site along with a person who hasn't completed all their training yet, along with a deadline by when training would be finished. And then some provisions regarding what are called retainer payments so that some of our day providers who aren't going to be able to provide services during this time will be able to be compensated to hopefully keep them afloat for after this ends.
Please explain the oversight in place to ensure that providers have developed CEPPs and PEPPs.
So we requested CEPPs from all of our providers on March the 13th. We had actually, prior to that, reached out to all of our providers and asked them to make sure that their CEPPs, which is their continuing, what is it?
Comprehensive Emergency Preparedness Plans.
Thank you. Comprehensive emergency preparedness plans, that we asked them to look at them, make sure that they were updated to address an emergency of this nature, which is the first time any of us have dealt with something like this, I expect. And then we asked them to submit those. We asked them to get them into us by the 17th. We've gotten them all back. We're now reviewing them, and we will get back with providers if we have any concerns about them. We haven't asked them to submit their personal emergency preparedness plans because as we looked at those and looked at them with other folks here, the kinds of issues that they addressed were not really relevant to the current emergency.
Have all providers submitted CEPPs and PEPPs?
It appears we still have 2 outstanding as of today, but the quality resource specialists are reaching out to them to make sure that the last 2 get submitted.
Has DDS ensured the team has participated in development of these plans?
So we're reviewing all the plans now. It's an interesting question whether the team has input into the development of the plan because I don't know, quite frankly, that that is a required part of the plan.
No. So from the quality resource perspective, we are examining each plan and we reach out to service coordination and other folks in the building should the need arise. But we're just examining to see if there are any gaps or any resource limitations in those plans and address them as on a case-by-case basis.
Is there clinical staff at DDS assessing the adequacy of the plan?
The plans are being assessed by the quality resource units.
How quickly are the plans being assessed?
They're being reviewed as they come in, and we expect to have reviewed all plans and then reached out to providers with concerns by early next week.
Is there any guidance from DDS regarding what should be included in these plans?
So actually, you know, when these plans were originally developed, we had contracted with an expert in the area of emergency preparedness who was an expert in emergency preparedness for people with disabilities. And she actually worked with all the providers in the development of their initial plans. We then reached out to the providers to, we gave them some guidance on the 13th in terms of what additional things needed to be included for this particular emergency. And gave them that guidance before asking them to submit their plans to us.
Does DDS have a plan if staffing in the homes becomes inadequate due to staff not reporting to work because they are ill or for other reasons?
So part of what we've included in the Appendix K is some flexibility in hiring so that providers are able to bring people on more quickly. In addition to this, we have some day programs where they're not continuing to provide services, and there may be folks who work there who could immediately start working for another provider.
Will DDA staff assist in providing staffing support?
No.
Is DDS assisting providers in searching for people to fill the current vacancies and the likely growing future vacancies?
No, I know that there's been some coordination between DCHR and DOES with the providers, and so the city is working to help with, to the extent they can, to help with bringing people on board. You know, the sort of silver lining on one of the really challenging things in this current crisis is the huge unemployment rate that we have currently. There are a lot of people out there who are looking for work right now. And so our hope is that we will be able to bring qualified people on quickly, or the providers will be able to bring qualified people on quickly.
Have provider staff who work with DDA consumers directly been deemed essential employees? If no, why not?
Part of the mayor's order was to identify a number of different classes of employees who are considered essential. And the people who work with our population have been are included in that definition of what is an essential employee.
Has DDS provided technical assistance to providers regarding how to support individuals who are likely very scared and confused right now?
So the person, if they already had psychological support, could access through their telehealth, their provider through telehealth. And also, we're going to include any resources that the Department of Behavioral Health may have. But we would then expect that we are sharing that information with the personal service coordinator, that if those services were needed, then their adjustments would be made and proper authorizations and providers would be put in place, should the person not have already had those services in place.
I would also say one of the most important things right now is to continue to remind people of sort of the things that they can do to take care of themselves during this. And I know that it seems basic and simple, but continually reminding people that this is a virus you catch from other people, that it's very important to maintain your distance. It's very important to regularly wash your hands, to let someone know if you're not feeling well. And if you cough or sneeze, to do so either in a tissue or into your sleeve, if necessary.
In addition, our quality resource specialists are working with the providers that they are assigned to make sure that if any of the people that we support in these provider locations are having these issues or troubles, that we are notified about it, and we're also providing guidance on how to address and work with people that we support on these issues.
Okay, and so this is the last question that was submitted. With day programs closed, BDS is permitting providers to support people during the day in their homes if they are authorized to provide companion services. If the day program or supported living provider is not authorized to provide companion services but wants to be, can they be approved quickly? How long is it taking for DDS CHCF to authorize providers to provide companion services?
Our Appendix K does that, and so it will, once it's approved, it will be approved retroactive to March 11th, and providers have already started doing this. So if the providers are already an approved service provider, they would also be considered an approved companion service provider. So that should not be a challenge, because there is not going to be the typical qualification process with DHCF. Lastly, I just want to say we got a number of questions from the client assistance program at ULS, but they had asked for written responses by a particular date, just so that I don't know if there are people on the phone with concerns regarding Rehabilitation Services Administration. All of the questions seem to be related to students who are getting post-secondary education and how we're supporting them, because as people, I expect, know, very rare is the school in the country, the college in the country right now that has not moved to distance education. Our counselors have been reaching out to everyone they support who is in a college or university or any kind of post-secondary education training right now, making sure that they have everything they need so that they can transition from education in person to online education, making sure they have the necessary resources. And we have not heard any concerns about that transition so far. So if anyone does have those concerns, they should call their VR counselor or that person's supervisor. And there were a number of questions all related to that, it seemed to me, and those written responses will be provided.
So we have questions that you guys have typed in. What guidance has been issued and or updated with respect to making sure people you support are counted in the DC census? Reliable count residents by residents is unlikely to work in current circumstances.
I'm not clear why it's unlikely to work in the current circumstances, because so what happens for the census is that every one of us, fairly recently actually, has received something in the mail from the U.S. Census. Just for people's benefit, I'll let you know a mistake I made on it, which is the question that it asks is, on April 1, who resides in your home? As there have been all of these changes, And young people who are, or older people who are away at school, if they transition back home prior to April 1, they count as part of the household. So, you know, I was very anxious to fill my form out immediately, and then after I filled my form out, we had some changes in our household, so I've had to call the census to see how I can adjust my form. We have posted on our website, and we have provided guidance to our providers about making sure that we get counted in this census. The census is vital for the District of Columbia, and it's vital for folks with disabilities to make sure that we are counted. And so it's really important. When you get your census form, some people get a short form where you give just a little bit of information about who's in your home. Some people get a long form. And that long form is where they gather really important information about the makeup of the community. So people who don't answer the question online will receive a follow-up, either call first and then a follow-up visit from the Census Bureau to make sure that each household has responded. But we have sent something out reminding people that every household needs to respond to this and to check their mail and respond online. I'll just give the additional caution. We don't know from one day to the next how many people are going to be living in our homes. So while I was very anxious to fill out my form, you might want to wait until closer to April 1st, because the question is, who lives in your home on April 1st?
Just to interject, we have about 9 minutes left, so we're just going to try to get to some of these questions, but we may not be able to get to all.
Has the Appendix K process been completed?
It's being finalized, and our hope is that it will be submitted very, very soon. It's the finalization of it is done by DHCF. Not to be pushing anyone under the bus here, I just want to say it's been work between DDS and DHCF. We worked very closely on it, and I got an email this morning saying we hope that it will be submitted very, very soon, meaning ideally today, if not shortly thereafter.
Yes, CDS. Are there regs in place for home health workers to ensure safety of the staff and the patients, especially those who have multiple clients and are serving different households?
So we have sent guidance out. There's guidance that DC Health has provided about how people should be providing services. And that guidance is available on our website, and everyone should become familiar with it. Did you have something to add, Winslow?
All home health workers and others who travel through multiple settings are trained on universal precautions. And with regard to this particular outbreak, the hand washing, the using of personal protective equipment, and not working while you're ill is guidance that is a part of training prior to COVID-19 being an issue.
And there is, like I said, on our website, you can see very specific guidance for non-healthcare workers who are working with people in this current time.
Is CDS taking most liberal possible approach to intake eligibility at this time? Many with DD are suffering now and ineligible under current waiver.
As we had said in our performance hearing, and our position and our attorney's position is the statute dictates eligibility and our ability to expend funds based on that eligibility. So this is not a time that we could expand eligibility.
Do you have any advice for people who are currently unable to use their SNAP benefits because they cannot visit a grocery store in person, whether due to age, disability status, immunocompromised status, or having to quarantine?
In terms of advice, if the person does not have current supports in place, I would recommend, and I'm just by reading this question, all the people that DDA supports who have these types of needs would have those reviewed prior to COVID-19 and supports being put in place, as well as the opportunity to amend when their service delivery needs change even during COVID-19. So my assumption is this question comes from someone who's not supported by DDA, and I would recommend contacting the DC Health and Human Services Department hotline to express concerns so that they can be referred to the appropriate agency.
Right. I don't know, for example, if you can use SNAP benefits to order food online. You can go to the grocery store and maintain social distance from people. Ideally, you'd identify times when there aren't as many people at the grocery store. You would make sure and wash your hands. You know, I know the grocery store I go to has wipes available, so that you make sure before you touch the cart, you wipe it down, take all those necessary precautions, you know, to make sure, as I keep repeating, social distance from people, washing your hands regularly. You know, that's how all of us will stay safe through this.
And other, some grocery stores such as Harris Teeter, Safeway, have designated times for people who are elderly or have immunocompromised status. There are certain times, an hour, 2-hour gap where they will allow them to shop. So that might be helpful as well. Does CDS have any sense about the needs of people in the community who are not currently covered under the IDD waiver, or those people just off the radar?
They're certainly not off the radar. There's, in the Emergency Operations Center within the district government, there is a committee that is looking at human services. I'm on that committee. Jared's attending the meeting for me right now because I couldn't make the meeting today because of these calls. But these kinds of issues are the ones, you know, how do we make sure that all vulnerable people during this time are able to get access to food and shelter? Those are the kinds of things that we're looking at for the whole city.
We have 3 minutes left. Here's another question.
To the students with disabilities, this is especially important if their family does not yet qualify for home services and not only get support through related services in the IEP. Help is needed with troubleshooting, continuity of care, even if it's different laws that guide these services. We
agree. We elevated this question the other day so that it could be addressed by through the Deputy Mayor for Education's office, because there are people who get services other than just their education when they're in school. And so, you know, as people may be aware, we don't work with youth who are in school generally. And so that isn't something, unfortunately, that I know the answer to immediately, but it is something that we flagged and we've asked for an answer from Education to clarify for people who have service needs from their IEP, how are those needs being met during this time?
And are you collecting the chat questions to answer on the next call or before? So
we are collecting all of the questions, yes.
And we'll send out the answers. We'll send out a transcript of the answers to all participants or to our website. We'll post it on our website after this call.
Is this accessible?
Unfortunately, WebEx does not allow the feature to close caption, but we will provide a transcript of this call on the website after sometime next week and prior to the next call next week. If there are any additional questions, we'll be sending out also requests for more questions sometime next week.
Okay. Someone asked, in the App K, in Appendix K, is there anything in there about staffing ratios?
Yes. I think I had mentioned that last week, and it was in my summary. And yes, that is there, and that's been there from the beginning. And just so people know, DHCF did have a conversation early in the week with CMS and reviewed the sort of the outlines of what we had at that point, and CMS was generally favorable about everything that was there.
There was a follow-up question to the conversations around SED solutions.
How can we be looped into that conversation and can participate in helping find those sped solutions?
Those are conversations that would happen in the education cluster, so unfortunately, I don't know what to tell you there. I would just encourage you to reach out to someone on the education side with your questions. But like I said, we're trying to get the answer, so we'll see what we can find out, but you should do your advocacy with the education folks.
So that concludes the question portion of this forum and the forum itself. We just want to kind of remind people again to wash your hands. There was a suggestion that, if you sing the happy birthday song twice, that should be sufficient amount of time to wash your hands. Again, the full happy birthday song twice is enough time to wash your hands. So just a reminder to wash your hands. We will be holding the next forum next week at the same time. And I think we have one more.
I just wanted to also share for those who dialed in by phone and do not have access to the computer, if you have follow-up questions, if you can call Charlisa Payne at 202-442-8411. That's 202-442-8411. And as Kirk mentioned, we will have this meeting. This will be a recurring meeting, 10:30 every Friday. You all will receive invitations soon regarding the follow-up meetings. And so we're typing in Charlisa Payne's number now.
So thank you very much, everyone. Like I said, 10:30 next week, we'll be on the call. We're going to be figuring out the ways once we have all of this that we can make all of it available publicly. We don't know how large the document of this recording will be, but we can also get a transcript of the recording. So we want to make sure that all this information is available to the community. Thanks. Keep your questions coming. We'll do our best to respond. As I said, keep watching our website and the DC website. These things are changing every day, and stay aware of those basic things, taking care of yourself. Someone reminded me, washing your hands for 20 seconds, taking care of yourself, making sure you're keeping your distance from people, and making sure you're figuring out things you can do to stay comfortable during this time when we're not supposed to be. Social distancing is challenging, not just physically, but emotionally, to not be able to get close to people. So working with the people you live with to come up with things you can do to stay healthy during this time. Talk to you all next week. Thanks.